Difficulty in passing urine and pain around the groin and testicles. Nah, that's not normal. Prostatitis can be defined as an inflammation of the prostate and is usually due to a bacterial infection. Take a look at this picture here. This is your prostate. As you can see here, it's surrounded by loads of different organs, including bladder, the penis, and your testicles, including the muscles and blood vessels on the pelvic floor. So you can see here that if there's any inflammation or irritation of the prostate, you can get these issues spreading and affecting the surrounding organs. So in acute prostatitis, the symptoms usually develop quite rapidly over a few days. And we have a few really common symptoms, which may include severe pain, and an intense pain is a hallmark of this condition. It's usually around the base of the penis, the testicles, also around the rectal area. The pain can also radiate to the lower back. A lot of patients complain of discomfort on opening their bowels. Patients can also have symptoms that affect the urine production, including a discomfort in passing urine, also having to go to the toilet more often for a wee. Certain patients might find some blood in the urine. Now, other symptoms to be aware of will include a fever if the infection becomes more systemic. So you may feel a bit under the weather, like you've got a cold or flu, as well as having some kind of general aches and pains as well. Some patients may also have some discharge from the end of the penis, which may be a thick fluid. So I think it's really important to remember that we've got all these different symptoms, but they can be caused by loads of other conditions. This is why it's really important to see your GP or healthcare provider if you have any of these symptoms, so it can be further addressed. So Dr. Derek here. Let's think about acute prostatitis and how common it is in the population. About 8% of men in the UK will have prostatitis at some point during their lifetime. We've got certain factors such as prostate damage, catheter use, and a urine infection. These are all things that can commonly cause inflammation of the prostate. And as I mentioned before, most causes of acute prostatitis are due to a bacterial infection. So how does a doctor actually diagnose this condition? Well, the symptoms that you have are quite typical, and putting them all together are quite typical for this condition. The doctor may also do a physical examination, which will include an examination of the prostate itself, and also a urine sample can be sent to the lab for further identification of any bacteria that might be found in the urine. So let's have a think about how this condition can be treated. So acute prostatitis is usually treated with a very long course of antibiotics, typically between 2 and 4 weeks. Now, it's really important that you actually complete the course of antibiotics in order to avoid any failure of treatment. It's also really important so we avoid any antibiotic resistance. And we also know that not completing a course of antibiotics puts you at risk of developing chronic prostatitis, meaning that it's harder to treat. And certain patients could develop chronic pelvic pain syndrome from untreated prostatitis. Ibuprofen or paracetamol can be used for pain relief. And also laxatives can be used to soften stool because, as mentioned before, certain patients can get a lot of discomfort on opening their bowels due to prostatitis. So that brings us to the end of today's video. As always, if you found it helpful, don't forget to leave a like and subscribe to this channel. Make sure you check out some of the other videos on this channel and share it with your friends and family that you feel may also benefit from this information. And until the next time, I'll see you soon.